welcome to a new session on Edentu. So for the NEET MDS aspirants, we started a new subject this week, which is called the oral radiology. Okay. Now, before starting this discussion, let me tell you one thing clearly. Today, we are not going to discuss the multiple choice questions or the previous year questions. Okay. This session is just like a trailer of the movie. Okay. So what we are going to discuss today is mainly on the preparation strategies for this oral radiology subject. That is how to tackle this oral radiology subject. Okay. So we'll be mainly analyzing four things today. The first thing is like what is the general weightage of this oral radiology topic? Like how many subjects, how many questions can be asked from this oral radiology subject in the NEET MDS examination. And the second thing we are going to analyze is we will look at the previous trend of the oral radiology subject, like how many questions were asked in the previous year NEET MDS examinations, like from 2017 till 2024, we will be analyzing like what was the weightage of oral radiology subject for the NEET MDS examination. Then third thing that we are going to analyze is the questions. Okay, all the questions from 2017 till 2024 that were asked for the oral radiology exam, and we will see which topic has the maximum weightage. Like we will see from which topic more questions were asked repeatedly, so that you will get a general idea on like which topic you should be focusing more while you are studying. Okay. And then last, we will see about the how many image-based questions and how many clinical or case-based questions were asked from this oral radiology topic. Okay. So let's begin. So this oral radiology, it's a beautiful subject, which is like an amalgamation of physics and radiology together. It has some overlapping topics with oral pathology and oral surgery, but it also has very exclusive topics that are like exclusive to the oral radiology, like the radiation physics and the processing and the projection geometry and extraoral radiography, like that. All topics are like exclusive to the oral radiology also. So oral medicine together with oral radiology, we can expect a total of like 14 to 15 questions for the NEET MDS exam. From oral radiology alone, we can expect a total of like 7 to 8 questions. Okay. Now let's look at the trend of the oral radiology questions that were asked in the previous year. Okay, so from starting from 2017 till 2024, you can see that a maximum of like 8 questions and a minimum of like 5 questions were asked in these years. Okay, in these last 7 years. So anywhere between 5 to 8 questions can be asked. And as I had already mentioned, since it had some overlapping topics with the oral pathology, some can be included in the oral pathology also. So that's why a little bit of less number of questions in the 2021 and 2023 and okay. Otherwise, generally you can expect a total anywhere between 5 to 8 questions. Okay. Now let's look at the questions. These are the questions that are asked in the previous year question papers, and these are the major topics. Okay, these are the major topics of the oral radiology subject. So we will analyze each question and we will see in which topic it belongs to. Okay, so the first one is an image-based questions based on the diagnosis. So it mainly comes under the radiographic diagnosis part. Okay, radiographic diagnosis topic. Okay, the next is an IOPA question, which is causing the radio opacity or the abscess of the maxillary molars. It is mainly included under the intraoral radiography topic. And the last one is the debris and scratches in the intensifying screen. It belongs to the intensifying screen topic here. Okay, so mainly 3 topics. And next is the potassium bromide in developer function. It mainly belongs to the processing of the X-ray films. Then next is a question about the MRI sequence, which belongs to the extraoral radiography topic. And next also the cephalogram, again, it belongs to the extraoral radiography. Next question is about the intensifying screen, which belongs to the intensifying screen topic here. And next is about the digital sensors in the bucket brigade fraction. So digital radiography, let's put it under the miscellaneous section here. Okay. So since the digital, we will not put it under the extraoral radiography, digital radiography will put it under the miscellaneous section here. So that is included under it. And again, the diagnosis of the OPG, which comes under the radiographic diagnosis. Now, next is the size of the film used to take the bite wing. Again, X-ray film topic. The next is Bucky diaphragm, which again comes in the projection geometry, and grid ratio also comes under the projection geometry topic. Okay, then next is the PET scan. About PET scan, again comes under the extraoral radiography. Sharpness of image increases by which method? It comes under the projection geometry, and the side effect of radiation, which comes under the biological effects of radiation. And the CBCT. Next question is about the CBCT, cone beam computed tomography. It comes under the extraoral radiography. Then again, identify the OPG, which comes under the radiographic diagnosis. And next is about the thermoluminescent dosimeter, which comes under the radiation safety and protection topic. Next is about the full mouth X-ray, which again comes under the X-ray film. Again, two image-based questions, an occlusal radiograph and an OPG, and identify the lesion and identify the diagnosis. So both of it comes under the radiographic diagnosis topic. Next is object lingual to reference point detected with, again, comes in the projection geometry. And in a patient having, again, a clinical based question have been asked, like in a patient having dense bones, penetration is best achieved by, again, a projection geometry. And penny coin test is, it mainly comes under the topic of processing of X-ray films. Then next you have the zygomatic arch, in which radiographic view the zygomatic arch is not visible. It comes under the extraoral radiography. And then again, two image-based questions, clinical and image-based questions are given, which comes under the radiographic diagnosis questions. Okay, one is nevoid basal cell carcinoma diagnosis, and other one is the Eagle syndrome diagnosis. Again, the lot of like image-based questions were asked in 2020. The first one is about Cruson syndrome. The next one is about odontom, and the last one is about silolith. Okay, this odontom is a favorite topic in oral radiology. You can see like repeated questions asking about odontom, giving the OPG or the IOPA. Okay, so odontom is one of the favorite topics in the oral radiology subject. Now, next, again, lot of image-based questions are there. You can see that, again, the odontom is repeating in the 2021 NEET MDS exam also. You know, OPG of OKC is given and asked to diagnose it. Then, an IOPA of the cementoblastoma is given and asked to identify the lesion. Okay, so this all comes under the radiographic diagnosis topics. The next is the loose bound electrons are displaced easily by S. It is UV rays. It comes under the radiation physics, and the radiation which ejects the lower energy photons. It is microwave radiation, which also comes under the radiation physics. And again, an image-based questions for the identification, which is the Talon's cusp, and it comes under the topic of radiographic diagnosis. The next, all the three are image-based questions. One is in the artifacts like cupping, hardening, and the partial walling scattering are all seen in which radiograph? It is CBCT and extraoral radiography. So we included it under the extraoral radiography. Then again, xylogram is given. A pathology of the xylogram is given. How to, okay. Like, doctor, if I will explain the topics first, and I will analyze the question first and the topics in the last. Okay, so we will analyze from which topics more questions were asked. Okay, that will be analyzed at the, like, after 2 or 3 slides, you will be able to know like which topics that you should be focusing more on, because more questions were asked from that topic. Okay, so I'll tell you that after like 1 or 2 slides. Okay, then I will explain you how to start preparing also. Okay, now next condition, pterodontism. Okay, the diagnosis. Again, the diagnosis given pterodontism, image-based questions. It belongs to the radiographic diagnosis. Then the artifact in this thing, all are like image-based questions only. Artifact mainly comes under the processing of the X-ray films, and this normal structure. Okay, this a structure marked by arrow in the radiograph. Okay, it is since it is a normal anatomic structure, we can put it under the intraoral radiography. And here also, since it is not a pathology and a normal radiographic structure, we will put it under the extraoral radiography. So if you look at the 2023 questions, you can see that again, odontoma is repeating. Odontoma is like one of the favorite topics in the oral radiology. Again and again, it is repeating. Only the position of the odontoma is changing. Otherwise, it is repeating like every 1 or 2 years. Okay. And the areas of light and dark appears as dark in a radiographic film, again, due to processing of their X-ray films. And radiation in cancer radiotherapy comes under the biological effects of radiation. Next is 8 film survey, comes under the topic of X-ray film. Again, a diagnostic question, odontoma, comes under the radiographic diagnosis topic. Stochastic effect of radiation, which is radiation-induced cancer, which is included under the biological effect of radiation. And the radiographic technique that is most effective for detecting early proximal caries. Okay, these were the questions that were asked in the 2024 exam. Okay, this last March. Okay, so the radiographic technique that is most effective for detecting proximal caries, it is included under the intraoral radiography. And one clinical based question is also there. Patient had injury to a face and complaints of pain in the subcondylar region. What will be the best radiographic method? So it is called a reverse down method, which belongs under the extraoral radiography. Okay. Now this radiotherapy is not sensitive in, again, biological effects of radiation. And what will be the appearance of X-ray film after development if it has been stored properly? Okay, that will come under the processing of X-ray film. So we have from 2017 till 2024, we have analyzed a total of like 52 questions. Okay, now after analyzing 52 questions, you can see that more questions were asked from this radiographic diagnosis topic. Okay, so I think Dr. Sri asked me like how you can proceed with the oral radiology subject. Okay, so I will first ask you to concentrate more on this radiographic diagnosis topic. Okay, because it contains the more number of questions. Okay, so after reading the basics of the radiation physics and the radiation biology, then I will ask you to focus more on this radiographic diagnosis topic. Okay. Now, the next more important topic that you should be focusing more on is the X-ray film intensifying screen and the processing of X-ray films, and also the projection geometry and the intraoral radiography. Okay, that is the second most common topic that you should be focusing more on, because more and more questions were asked from that also. Then the fourth topic that you should be concentrating more on will be the extraoral radiography. Okay, so these 4 topics that you should be focusing more on while studying the oral radiology. First is radiographic diagnosis, then the X-ray film intensifying screen and the processing of X-ray films, then the projection geometry and the intraoral radiography, then the extraoral radiography. Okay, I'm not telling that you should not even read the other topics. You should also read the other topics, but more questions were asked in the NEET exams from these topics. So you should be focusing more on these topics. Okay. Now, any doubts, Dr. Sri? Any doubts? Okay, now I will also tell you about the image-based questions and the case-based question. As you can see, there were like 22 image-based questions out of this 52 questions. That is like half of the questions were like image-based questions only. Especially in the radiographic diagnosis topic, you can get a lot of image-based questions. Okay. So, which book? Yeah. The main standard book for reading the oral radiology is White and Furrow only. Okay. So, but it will be unable to read the whole book if you are preparing. So I will ask you to mainly look at the images from the book, okay? And then practice the MCQs, okay? So let me tell you a tip. Yes, notes are available in the Edentu app, okay? So you can try contacting the Edentu app administrator for the notes, okay? Any other doubt, doctor? Like prepared notes are available for every subject in our app. You can try contact the uh, administrator of the app, okay? How to schedule the schedule, how many hours you should study, the notes, the videos of the notes, the days for studying, everything is given in our app. If you can contact the administrator, then all these will be sorted out. I will tell you a simple trick to learn this image-based question. Okay. So image-based questions are like very common now in every NEET exam. Yes, Dr. Sri, I will give you the phone number. Okay. Or you can log into our Instagram channel and you can see the number there. Okay. Just put a DM in our Instagram channel. Okay, doctor? Okay, okay, okay. Now, let me tell you one of the simple tips to study this image-based questions. Okay, so like from last last 5 years onwards, like a lot of image-based questions were asked. In the 2024 exam itself, if you see, there was like a minimum of 2 image-based questions were asked from every subject. Okay, from every subject, a minimum of 2 image-based questions were asked. So I will tell you to focus more on this image-based questions also. So I will tell you a little tip to study this image-based questions. So take a standard textbook. Okay, like I had already told Dr. Sri, for oral radiology, you can take the standard textbook like White and Furrow and just go through the pages. Okay. Now, whenever you go through the pages, whenever you see an image, just look at the image and read the subheading under it. Okay. Then repeat it for like 1 or 2 times. And by the third time, when you are looking at the images, try to mask or hide the subheading and try to identify the image that is there. Okay. So by this, you will be gradually able to tackle the image-based questions. Okay. A lot of clinical or case-based questions were given in our app also. So for if you want to do it like an exercise, it will be very useful to utilize our app also. And a lot of these clinical based questions are are the ones with images also. So we have included the both of them in these topics. Okay. So let me tell you some ways, some features of our app and some of the easy ways to where you can utilize our app more efficiently. Okay. So you can get our app from the Play Store or the App Store, and this is the login page. And in that, if you see, there is a course list. Okay. In that course list, every subject will be given. And in that, if you are choosing oral radiology, under the oral radiology, also the radiation biology, radiation physics, whatever we had discussed till now, all those will be seen. And under every topic, there will be a video class, there will be notes, and there will be exercise. Okay, so first you can attend the video class if you want, and then go through the notes of the subject. And then if you want to analyze yourself, by doing the MCQs, then you can do the exercise also. Okay. So that is the main specialties of our app. If you have any doubts, you can ask me, Dr. Sri, Dr. Piyush. Any doubts, you can ask me. And I will also tell you the schedule of oral radiology this week. Okay. So this is how we make the schedule and all. So this is the schedule of oral radiology. 1 week it will be for the one subject. So we have the on the 30th, 2nd, 4th, and 5th, we will be having the radiology test. And on the 5th, we'll be also having the subject test in the whole. And the 6th, we'll be having a cumulative test. The past previous subjects, along with this oral radiology, will be having a cumulative test. And on the 7th, we'll be having a grand test. Like all the subjects that are covered till now together, along with that, we will have a grand test also. And we have live classes also on 3 days. On 4th, 5th, and 7th, we'll be having live classes by one of our experienced oral radiology faculty. And she will be explaining in detail about all these MCQs and the previous year questions and how to tackle each question and how to understand this image-based questions and the clinical-based questions. All will be there. Live class, it's not theory. Theory will be, live class will be mainly on MCQ discussion. Okay. For theory part, there will be the videos in the app itself. Okay. That has the theory part. Live class will be mainly doing the MCQ discussion only. Okay. Any other doubt? Any other doubt, Dr. Sri, Dr. Piyush? If there's any other doubt, then you can ask me now. I hope you get a rough idea of how to start the oral radiology subject, Dr. Sri. Yes, I hope you got a rough idea. Okay. Thank you, Dr. Sri. If you are having any doubts, please contact our academic administrator. Okay. You can DM in our social media channel. Okay, then they will contact you and will let you know everything. Okay, doctor? Yes, there will be personal mentorship also. Dual personal mentorship will also be available. There are experienced staff for that. Yes, Dr. Piyush, you want to tell something? Okay. I hope it's clear, Dr. Sri. Any other doubts? For every subject, when we are starting a new subject in our Edentu learning app, we will be going through a live video like this also, explaining the important topics that you should be focusing more on, like that. High yield topics and the high yield topic discussions will be there. Any other doubts, Dr. Piyush and Dr. Sri? If you're having any other doubts, then you can put it in the chat box. Okay. What I told Piyush, it was that this session is just like a trailer of the movie. Okay. So, yeah. Okay, Piyush. Okay, I will explain it to you now itself. Okay, this session is just like a trailer of the movie. Okay. So what I'm trying to tell is I'll not be discussing the multiple choice questions or the previous year questions in this session. Okay. In this session, we'll be mainly focusing on how to approach this oral radiology subject, or like you can see, like what are the strategies to study this oral radiology topic. That we will be mainly discussing it. So when we analyze the previous year question papers also, we were able to find out that maximum like 7 to 8 questions can be asked from the oral radiology subject in every NEET subject, in every NEET exam. Okay. So we just now analyzed the questions from 2017 till 2024. Okay. And then we found out that which were the topics that are that you should be focusing more on, because more questions were asked from those topics repeatedly. I hope I'm clear about that, Dr. Piyush. Okay. Okay. If you have any doubt, then just DM our social media platform also. Okay. Okay. Any other doubts, doctor? Okay. I hope I'm making myself clear. Okay. 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 Thank you, Dr. Piyush. Thank you, Dr. Sri. Thank you for attending the session, and all the very best for your future exams. Thank you so much.